The things we introduce today are internal organs. First of all, one of the most important systems for life, the cardiovascular system, consists of heart and blood vessels. The heart is the pump making the blood circulate throughout the body. The blood vessels are the tubes that let the blood flow through. The vessels of which the blood leaves the heart are called arteries. Thinner ones are arterioles. The thinnest ones are the capillaries. The vessels of which the blood flowed towards the heart are called veins. Thinner ones are venules. Furthermore, the largest blood vessels leading to the heart are called the aorta and vena cava. The vessels with red color are highly oxygenated. Blue ones are low in oxygen but high in CO2. Now let's look at the anatomy of the heart. Aorta. Left pulmonary artery. Left pulmonary veins, superior vena cava. Right pulmonary arteries, right pulmonary veins. Right atrium. Left atrium. Right ventricle. Left ventricle. Inferior vena cava. Pulmonary valve. Tricuspid valve. Mitral valve. Aortic valve. Incidentally, these valves play a very important role in preventing backflow of blood. The connective tissue that connects these valves is the cardiac skeleton. This cardiac skeleton also helps prevent backflow of blood because it does not move slightly when the heart contracts. A related system to the cardiovascular system is the respiratory system, which breathes in oxygen and exhales carbon dioxide. The lungs exchange O2 and CO2 in tiny, invisible alveoli. Now, it's time to look at the anatomy of the respiratory system. Nasal cavity, nostril, oral cavity, pharynx, tongue, epiglottis, larynx, esophagus, trachea, carina of trachea, right main bronchus, left main bronchus, right lung, left lung. Next is the digestive system, which is responsible for the breakdown of food. Food is broken down primarily in the stomach to become nutrients, which are then absorbed in the small intestine. Then, what remains unabsorbed becomes stool in the large intestine. Now let's look at the anatomy of the digestive system. Oral cavity, mouth, salivary glands, pharynx, tongue, esophagus, stomach, liver, gallbladder, pancreas, duodenum, jejunum, ileum, cecum, appendix, ascending colon, transverse colon, descending colon, sigmoid colon, rectum, anus. This section introduces the urinary system, which filters and cleans the blood. The kidneys filter the blood to produce urine, which is stored in the bladder. It is then expelled through the urethra. We will look at the anatomy of the urinary system. Inferior vena cava, descending aorta, adrenal gland, right kidney, left kidney, ureter, bladder, urethra. Finally, the nervous system controls everything. It is involved in signaling and communication. The central nervous system, consisting of the brain and spinal cord, controls physical and mental activities. The peripheral nervous system includes the somatic and autonomic nerves, which transmit signals throughout the body. The internal organs are connected to the autonomic nervous system and are controlled autonomously. Let's look at the anatomy of the nervous system. Cerebrum, cerebellum, mesencephalon, pons, medulla oblongata, spinal cord, nerves. In this article, we will take a closer look at the nerves of the peripheral nervous system. Somatic nerves include sensory and motor nerves. Sensory organs transmit signals through sensory nerves. Muscles receive signals through the motor nerves and contract. Internal organs are controlled by the autonomic nervous system. The sympathetic nervous system creates a state of excitement to deal with dangerous situations. The parasympathetic nervous system does the opposite, working to calm the mind. There are 12 cranial nerves. Spinal nerves are divided into 5 sections: cervical, thoracic, lumbar, sacral, and coccygeal nerves. There are 8 pairs of cervical nerves, 12 pairs of thoracic nerves, 5 pairs of lumbar nerves, 5 pairs of sacral nerves, and 1 pair of coccygeal nerves. That's the end for today. Thank you for listening.